Hello, my name is Katrina Bossman and I'm a graduate student at Colorado Christian University. Today I'll be teaching you about the topic of prenatal care, specifically teratogens and environmental toxins and their place in lifespan development. As an overview, I will be defining the definition of teratogens, discussing the many varieties of teratogens and environmental factors, as well as the biological, psychological, cognitive, social, and spiritual impact that prenatal care has on the baby as well as the mother. I will then provide you with resources available for further education and support. The development of a child is a critically sensitive period where development is rapid. In a woman's first trimester of pregnancy, there are 3 periods of growth, including the germinal period, the embryonic period, and the fetal period. According to scholars Barbara and Philip Newman, the child is particularly vulnerable in the embryonic period between the weeks of 3 and 9 to the disruptive influence to what is known as teratogens. Teratogens are agents that can produce malformations in the baby while the child's tissue and organs are still forming, including the central nervous system and the heart. Teratogens can come in the form of viruses, medicines, alcohol, and other drugs, as well as environmental toxins that the mother is exposed to. The presence of teratogens or environmental toxins can result in birth defects for the baby. Although not all birth defects can be prevented, a woman can take the necessary steps to increase the best health possible for her child. So now that we have taken a little time to define what teratogens are, I would like to get all the students involved in this lecture. I'm going to hold up a couple of household items, and I just want you to jot down on your paper your initial perception on whether or not these items could pose as a threat to prenatal care. Later on, you'll discuss these items as a group. Okay? So the first item I wanted to show you was Pepto-Bismol. So it's an anti-diarrheal for upset stomach reliever. So the next item that I'm going to show you is just simple ibuprofen. Next we have tuna fish, just a can of tuna. The next item is going to be some Dayquil medication, just your cough suppressant. And then the last item I have to show you is just an assortment of herbal teas, so green teas, white teas, and black teas. So keep these in mind as we discuss the different teratogens that a mother might experience. So now let's take a look at the different categories of teratogens and how they affect the mother and the child. So viruses or infections are considered a teratogen that can have lifelong effects on a child. An organization that serves as a partner for children's health, called About Kids Health, provided a list of viruses and infections, including chickenpox, shingles, hepatitis B, C, D, and E, enterovirus, AIDS, listeria, rubella, herpes, any STDs, and syphilis. So some birth defects that can be acquired from teratogens as a result of a virus or infection in the mother include mental retardation, learning problems, jaundice, anemia, low birth weight, and vision problems. So it's very important for any mother to talk to their doctor about any viruses or infections they may have as well, so that the doctor can treat the mother and possibly the baby appropriately. Medicines taken by the mother have the ability to metabolize in the placenta and travel through to the fetus. Although some medications are acceptable to take during pregnancy, Newman suggests that the consequence to the fetus depends on 3 things: the dosage, the duration that the medication was taken, and the timing of the exposure. So maternal drug use at any time, including the use of nicotine, alcohol, and any narcotics, are strictly prohibited in pregnancy. Mothers who smoke are at a greater risk for experiencing miscarriages, stillbirths, preterm deliveries, and infant mortality. The child may be at a higher risk for a cleft lip and cleft palate, ear infections, and respiratory diseases as a result of nicotine. Newman states that research has shown that prenatal exposure to alcohol can disrupt brain development, interfere with cell development and organization, and modify the production of neurotransmitters, which can lead to fatal alcohol spectrum disorders or fetal alcohol syndrome. The use of narcotics have been shown to place babies at a higher risk for SIDS, low birth weight, and cortisol reactivity, which contributes to a person's ability to manage and regulate responses to stressors. Long-term impacts on the child include cognitive abilities such as fine motor coordination, difficulty focusing and maintaining attention, which can result in school adjustment problems. Environmental toxins are commonly found in the mother's workplace through air, water, and the handling of mercury, which is in many products. So exposure to chemicals and various hazardous toxins have an impact on the child in the womb. Interestingly, Newman states that pregnant women can also be susceptible to these toxins by their loved ones by experiencing secondary exposure. So as I have discussed, teratogens have the ability to affect a child's biological makeup, which in turn can affect the child physiologically, cognitively, and socially. So you may be wondering, okay, but how does this information affect me, a high school student? So for some individuals, acquiring this knowledge may allow you to understand your own personal lifespan and development. You know, if you or your loved ones have experienced any birth defects or struggles as a result of teratogens. So no matter the situation, children are valuable. As Psalm 127, verse 3 states, "Children are a heritage from the Lord, offspring a reward from Him. Like arrows in the hands of a warrior are children born in one's youth. Blessed is the man whose quiver is full of them." So as a society, we must be aware of how sacred a child's life is and work to give them the best future possible. From another perspective, as young adults, you now have the knowledge to educate others about the dangers of teratogens. You could possibly be that one person who changed the whole life course and development of a child. With this knowledge, you also have the responsibility to act on your part in order to prevent possible secondary exposure. If you're interested in learning more about prenatal care and teratogens, please visit the website for the nonprofit organization Mother to Baby, who are individuals dedicated to promoting evidence-based information to mothers, healthcare professionals, and the public about medications and exposures during pregnancy. You can find several valuable links on their website, including links to the National Birth Defects Prevention Network, the March of Dimes Birth Defects Prevention Network, and the Environmental Protection Agency. The Center for Disease and Control in Pregnancy also offer a list of medications safe to take during pregnancy, the effects in pregnancy, infection prevention, and what to do if you have been accidentally exposed to teratogens. So now, if your teacher can open up for discussion about the household items we looked at earlier, and then answer any questions you might have. Thank you.